Sorry to interrupt. Everyone good? Very good. So currently in Victoria there are 27 active cases of coronavirus. As we have reported, there were 3 locally acquired cases that were notified to the department yesterday. There are no new cases in hotel quarantining, and yesterday there were 21,292 tests that were reported to the department. I want to thank all of those Victorians who came forward and got tested. There is no more important thing than getting tested. In regards to the 3 cases, we did flag yesterday that whilst there's no such thing as a welcomed coronavirus case, that the processes that we put in place through our test, trace and isolate team and through the circuit breaker measures of earlier in the week gave us a degree of assurance that if there were to be new cases, they would be in those rings of Victorians who were doing the right thing through either primary contacts or secondary contacts and isolating. And that has been the case in these 3 new positive reports for yesterday. The 3 cases are from the same family, 2 parents and a child. 2 members of that family were previous residents of level 3 at the Holiday Inn at Tullamarine Airport and were primary contacts for that particular outbreak. 1 member of the household who was not at the Holiday Inn was considered a secondary contact and had been isolating with the other family members. All 3 had negative tests, multiple negative tests, between the 10th and the 12th of February. All have been quarantined at home during their infectious periods. The family took their day 11 test at a drive-through site close to their home yesterday and has, as a result, returned that negative test. Initial reports and interviews were underway last night, and those interviews have continued today. And again, we thank the family for, from all of those reports, being isolated throughout their entire infectious period and throughout the entire period that they have been quarantining at home. We've also got an update in regards to the vaccine rollout. We put out a statement a little while ago. We can confirm information regarding the rollout of the Commonwealth's COVID-19 vaccination program commencing Monday. From Monday, we will start vaccinating those Victorians who are most at risk of contracting the coronavirus and are at the front line of be it either border facing or hospital and healthcare work facing risks from the COVID-19 pandemic. When it comes to the hotel quarantine workers, port of entry workers, frontline staff, these are the groups that are most likely to be at the forefront of that international facing risks, and they will be the ones in this first Commonwealth Phase 1A, as they are calling it. Whether it's the specialist workers at hotel quarantine in Victoria, at the airports, at the COVID specialist wards, the ICU wards, those kind of settings, we will see some significant number of Victorians at the sites start their COVID vaccinations as of Monday. We will also commence the public sector residential aged care testing, Victoria being the only state with a significant public sector residential aged care community, which the state will be doing those on behalf of that sector, whilst the Commonwealth will be responsible for the significantly larger private residential aged care sector. All of this work will commence from our hubs at the Austin Hospital, Barwon Health, Western Health and Monash Health Services. Monash Health will also work with Alfred Health around that initial rollout to those high risk, particularly hotel workers, given the important role that Alfred Health had been playing in infection prevention and control at particularly the health hotels. Much of this work will be conducted on site at the hubs, the Pfizer hubs at these locations, but not all of it. Some of it will take place at specialist outreach sites, such as Western Health, for instance, will be establishing a hub at Melbourne Airport, given the high numbers of workers in this at-risk group at the airport. All other of the remaining hospital hubs will be coming progressively online as the Commonwealth provides all of the states the increased numbers of the Pfizer vaccine that has been scheduled to arrive in coming weeks. Again, we have these settings in place ready to support the rollout. We want to thank the Commonwealth for the constructive partnership that they have shown in delivering their program. All of the Victorian health services that we had previously announced are ready. We are there, ready to go when the Commonwealth provide the vaccine. As new supplies are further approved, we've already had obviously the AstraZeneca program, the AstraZeneca vaccine approved this week. Novavax and others will presumably come online as the announced schedule of the rollout, the biggest single logistical exercise in Australia's medical history and arguably of any program. As the Prime Minister has indicated, the program is scheduled to start next week and run through to the end of October in a series of phases. Phase 1A commences next week, runs into March. Phase 1B is scheduled to commence later in March, and the Victorian Government is very keen and ready, willing and able to assist the Commonwealth in this really important turning point in how we as a country, we as a community respond to this pandemic. As the Chief Health Officer has indicated, this is a very important milestone, arguably the beginning of the end of the pandemic, but that does not mitigate the need for us to continue all of the measures that we have in place, the social distancing, the mask wearing, the hand sanitising. All of these really important measures will continue to be important for some time yet, a substantial period of time. But the vaccination program is clearly an important milestone and one we welcome. I might ask Jerome to expand on some of the operational matters, and then we're happy to take a few questions.
Thank you, Minister. Good morning. I think the three positive cases we've seen overnight highlights the importance of that primary close contact approach, the three rings that we've adopted throughout this entire outbreak, ensuring that those people were clearly identified early on. They did test negative on the 10th of February, and of course, as we've seen, with their day 11 testing now, of course, turning positive, and we'll continue to support them throughout their period. And that is why day 11 testing is such a critical part of our approach to all the primary close contacts that we identify in this outbreak. We currently have, for the Holiday Inn outbreak, now a total of 3,515 primary close contacts. Again, some more work being done, particularly around some of the exposure sites. And my thanks to people who continue to come forward around some of the exposure sites so we can work with them, get them tested and establish their detailed movements to establish their level of exposure and risk. And that work, of course, continues. We still have 59 defined around the household and primary social groups. That number hasn't changed for a few days. And 1,342 from the exposure sites, with remainder coming out of the hotel quarantine program and, of course, Terminal 4 at Melbourne Airport. I can confirm of the primary close contacts identified on the 15th of February, so a few days ago, 99.7% were contacted within the national 48-hour benchmark, and that brings the average I didn't have the other day. The average over the last 7 days is now 99.8% of primary close contacts being contacted within that 48-hour period. And as we said a number of times before, the reality of that, of course, for the vast majority of primary close contacts, far quicker than that. I'm also pleased to confirm that with the Grand Hyatt outbreak now a couple of weeks ago, we're now starting to see those primary close contacts being released. We had a total of 1,507 primary close contacts associated with the Grand Hyatt outbreak. We now have around 942 left. We contacted around 350 people yesterday to stand them down as primary close contacts, and that work continues over the coming days. And my thanks to everybody who's been doing the hard yards. When you are a primary close contact, it is a challenging situation. You'll be concerned, of course, not only about your health, but also about the support you need to isolate safely. And my thanks to so many people for doing the hard yards in isolation, and good to see with Grand Hyatt now starting to appear in the rearview mirror. And of course, we're keen to be getting on with our day 11 testing on Holiday Inn, and hopeful of good progress over the next week. We also touched on wastewater results yesterday, and in our Chief Health Officer update yesterday, we identified a number of unexpected wastewater detections across some of our Melbourne surveillance sites. As I think we've been talking about over a number of weeks now, we've again stepped up the granularity of our wastewater sampling across the metropolitan area. And although we have no obvious connections between the new locations that are flagged up and any known positive cases, we are therefore asking people in a couple of areas to be particularly vigilant for any potential symptoms they may have. Those locations are Wantirna South and Boronia, which includes Bayswater, Ferntree Gully, Knoxfield and Tremont, and Carrum Downs, Skye, St Kilda East, Caulfield North, Caulfield, Balaclava and Elsternwick. Again, if you're in those catchment areas, and if you have any reason to be concerned about any symptoms you might be showing, no matter how slight, we really would ask you to come and get tested today. Which neatly brings me on to testing. With the 21,000 results from yesterday, that brings to around 275,000 the total number of tests we've run during the course of this outbreak since the first positive case was identified back 2 Sundays ago. So a really sustained and strong performance by all Victorians coming forward to get tested, and I'm so very, very grateful for all those 275,000 test results over the last 10 days or so. Of course, we want to make sure we keep people coming forward to get tested, whether it's around the wastewater areas or the exposure sites, or people more generally in the community, so we can stay on top of this and not have to go back to more significant measures. So we are keeping our testing sites open. We still have our rapid response teams out there testing in a number of locations. Our in-home testing service is still available and activated and available to those who cannot get access to our testing stations. And we have our surge capacity ready, as we've shown over the last 2 weeks. Our surge capacity is standing and ready to respond, should it need to any further outbreaks. I don't anticipate any major waiting times over the next few days. I think it will be we'll see some quieter testing stations. Please use our website to identify any the station nearest to you and the waiting times that we will have updated in real time. And with that, we will take any questions.
Just to clarify, when were those 2 cases get out of hotel quarantine?
So the 3 cases had a planned departure from hotel quarantine on Sunday, the 7th of February. That was the departure date for all the 3rd floor residents of the Holiday Inn. They were contacted that night on Sunday night and identified as casual contacts, given the positive case we identified on Sunday night, and they were then identified as primary close contacts on Tuesday when we identified the other cases. So this family of 3, along with all the other, I think 88 residents who left the Holiday Inn on the 7th of February, have all been in isolation since then. They were all tested on the 10th, on the Wednesday. Most of them returned a negative test result. We have 3 turning positive, and we'll continue those day 11 tests with the rest of that cohort.
The working assumption is that they'll probably infect the same.
That's right. That's right.
That's
That's right. So again, it continues to build this picture of this super spreader event on the 3rd floor at the Holiday Inn on the 3rd or 4th of February. Again, we know that this particular family was also accommodated in one room on the 3rd floor, and it adds to that wider impact. Clearly, their incubation period appears to have been somewhat longer, so they did not test positive on the 10th, so 6-7 days after their exposure period. And again, the conversations we've had recently, we know that some people will present far later in that 14-day period. So that's why it's so important we do that day 11 testing.
Was it just a day 3 and a day 11?
That's right. That's right. It was a day 3 and a day 11. That's right.
Whereabouts specifically?
I don't have that map in my head, but they were certainly part of that. It's a triangular floor of the Holiday Inn, and my understanding is they were in that same corner of that part of the building. I can confirm that for you. All 3. So it's a family of 3 who are all at the Holiday Inn. One family in one room.
I thought there was one member of the family who wasn't on holiday. I thought the parents were on holiday and the child wasn't.
I can confirm that for you. My understanding is all 3 were at the Holiday Inn. Look, I think as we've seen over the last 6 months or so, since we've really started driving our wastewater program, we see these detections coming up. It's at this point in time, it's an isolated set of detections, so we're not excessively worried. We know there's a number of things that can contribute. So we have 26 active cases of coronavirus in Victoria at this point in time. They're all safely in isolation. We know that people who have come out of their infectious period can still shed coronavirus. So it could be people who are not infectious anymore, who are now shedding, who've moved into those areas. But again, we use this as an early warning system, and again, it's a good prompt. We're not excessively concerned, but it's important that we share it with the community so that people can, if they're in those areas, they can act accordingly. Absolutely. Yeah. Into the testing hub or the vaccination hub? Yeah. Yeah, so we're setting up, of course, the vaccination facility at Melbourne Airport is only for those targeted frontline airside workers, essentially, who are at risk of coming into contact with people from overseas and aircrew from overseas. It will be in an airside facility. It's being set up by our colleagues at Western Health. We're very confident around the arrangements that will be in place for that to ensure, safe and effective vaccination starting on Monday, and that will carry through for the next few weeks. So Alfred Health for the workers in terms of their testing sites. So Monash Health will be running a number of vaccination hubs. At Monash Health and at Western Health and Sunshine, and those will start to open up from Monday of next week. We'll also be doing vaccination of the CQV workers when they're in their hotels in situ as part of their working shift. So for people who are currently rostered on, they will be progressively being vaccinated over the coming weeks during their normal working hours. For people who are not currently rostered on, they'll be able to access any one of the vaccination hubs and to get their vaccination there.
All the vaccination, all the workers at hotels in their shift will be done.
That's right. That's right.
The Premier said yesterday the vaccination rollouts in the tasks that the country. So is there any thought given to having vaccination hubs where testing sites can be
Sure. I might give that one to the Minister, actually.
So if I understood the question, it was, if we've got all these testing sites, why don't we flip them to vaccination sites? Fundamentally because the clinical infrastructure needs to be different, is one reason. And the other reason is this is a Commonwealth-led program, and if you are seeking to vaccinate under the Commonwealth's program at those areas of greatest risk to halt transmission, then you start at those places where the greatest risk is, at the airports, at the hotel quarantine venues, and where the greatest impact will be in the residential aged care facilities. So ultimately, once the Commonwealth's program moves into successive stages, particularly stage 2, due to start, I think, around May, those much more community-based sites are likely to come into play. You'll recall that the Commonwealth recently asked for expressions of interest for GPs to deliver the vaccination program, and my understanding is that more than 5,000 GPs around the country have expressed interest. The Commonwealth-led respiratory clinics that are already in operation, my understanding is that they will be ultimately brought online, particularly around phase 2. And I'm sure as the program evolves and as the Commonwealth provide more vaccines to states and for their own distribution networks, that we will see a substantial growth in the number of vaccination sites.
Do you want all the hotel quarantine workers to be vaccinated before we receive international flights?
Well, the Premier made some comments in regards to vaccinations, in regards to the return of international flights being paused at the moment. That's unrelated to the program of vaccinating the hotel quarantine workers. The hotel quarantine workforce still has many thousands of people in their care, and we will continue to see international flight crews for freight liners and all sorts of other reasons are coming into the country. So the two, whilst in the same space, are unrelated when it comes to the vaccine rollout program.
So what are we waiting for before international flights return?
Say that again?
What are we waiting for before we see international flights return?
Those are conversations that are underway between the Commonwealth and the state, and we just want to make sure that we have all the systems in place, all the understandings in place, and all the risks mitigated to make sure that whatever the next step in quarantining is, that it's safe.
Will you resume the hotel, the quarantine program using CBD hotels? Will you resume international travel on CBD hotels?
Well, these are matters that are under active discussion, and I'm sure we'll have more to say about that soon.
Apologies if you answered this earlier, I couldn't quite hear. In terms of aged care, is there a time frame for when, or a date when that rollout's due to start?
Yes, the aged care rollout will start Monday. The Commonwealth's program, the Federal Minister announced an extensive number of national suburbs. For obvious reasons, specific locations are being kept confidential. But the Commonwealth have committed to commencing private residential aged care vaccinations Monday, including sites in Victoria. Because Victoria is the only state with a significant proportion of public residential aged care, we've made sure that that is being dealt with at the same time by the state. That will commence Monday through Barwon Health, and Barwon Health will have a strong focus on that western part of the arrangements. Indeed, Barwon Health will be taking the vaccination program all the way to Portland, because of course Portland is an international port in its own right, and as part of their program they'll also be vaccinating those international border facing workers at the Port of Portland as part of their program. Can I shed any light on? No, I can't. I'm not a vaccinologist or a scientist. All the TGA approvals are again dealt with by the Commonwealth. I know there's something like 52 different vaccines under human trials globally at the moment. We've got obviously the TGA having approved the Pfizer and the AstraZeneca product. The Novavax one is in the system, and by all accounts there are quite a large number of other vaccines coming through.
When will the first vaccines be in regional Victoria?
As I indicated just before, through Barwon Health as from Monday, particularly in the residential aged care, and as I've indicated in settings like the Portland facing international port community down there.
When will the wider rollout as well as cover than that?
It will, in terms of residential aged care, that's been led by the Commonwealth as a part of Phase 1A, which in the material released by the Prime Minister 2 weeks ago almost, indicates Phase 1A to run from essentially Monday through to late March, and we're in the hands of the Commonwealth as to what the next stage is with further provisions of vaccine, but all of those cooperative, really significant plans have been settled, and we look forward to partnering with the Commonwealth to deliver their program.
When do you and the other members of government expect to be vaccinated?
When will?
For you and other members of
Oh, when
government
will?
be vaccinated?
When the public health team tell me to. I think I fall under 2A, so that will be some time. But I'll be vaccinated through a safe, effective and free system when the public health teams tell me to. Yeah.
Family at the holiday, 2 adults, child, yes.
Yes, let's clarify it, but there's the advice I've got is as follows. A family unit of 3 tested positive yesterday. That family, my advice is 2 of the people, one of the parents and the child, was the international travellers. They were released in the time frame as we said on that particular Sunday as casual contacts. The other member of the family as a secondary contact was also picked up through that, and all 3 have been isolating continuously throughout that period of time. I'm very confident that's the case, but out of an abundance of caution, we will get back to you all about that, but I'm confident that's the case. As part of their day 11 yes. So yesterday comes their day 11 test after having previously tested negative both at the Holiday Inn and on their day 3 primary and secondary close contact tests. And through the system we now have in place, returned a positive test yesterday, were interviewed late last night, confirming their isolation through all of that period of time and reaffirming the value of the test, trace and isolate system as being there to catch precisely this sort of circumstance. Well, I'm not an epidemiologist or a scientist, but common sense would seem to suggest that if you haven't met anybody else throughout that entire period of time, that that's a pretty strong possibility.
Everyone in that family, including the person who wasn't at the holiday, they've all been in isolation 6 Sunday to 7.
Correct. So they were released as casual contacts on the 7th and been isolating continuously as primary and secondary contacts from the 8th.
This may be a question for Jerome, but have we received negative results for all of the other guests for day 11 who exited?
I might ask Jerome to.
So yes, I can confirm that so far of all the day 11 test results, apart from these 3, the others have all been negative. Day 11 testing is continuing. And can I just clarify, yes, that was my misspeaking. It was 2 people, international arrivals, 3rd family member, all tested negative on day 3, all tested positive day 11.
And are there any other day 11 test results we're waiting to hear back?
We'll continue to see more day 11 tests coming through. I think we've got through all the CQV, the exiting residents now, but yeah, we'll continue to review those numbers on a day-to-day basis.
Talked about that triangle. Is there anyone who's still waiting? Anyone who's speculating is positive, or is it no tell?
Oh, look, I think that's the whole value of day 11 testing, and of course for those original hotel quarantine residents, we will also be doing day 14 testing in a few days' time. So if people are testing negative at day 11, that's a really positive sign, but we're being very, very precautionary now with this cohort, given the complexities we've seen around this outbreak. So we will be doing day 14 testing for them later on this week and early next week.
And how many guests will that be? So?
It's 88 residents who exited the hotel on Sunday the 7th of February who were, as the Minister has said, defined as casual contacts and then upgraded to primary contacts a few days later.
And 95, have they been rolled out to all workers yet?
That's an issue for CQV. My understanding is they're well on with that programme.
Well, this is a matter for the Commonwealth. They arrived internationally in Sydney. The TGA have been going through their quality assurance program. We're ready to receive them the minute they show up.
So you don't know when they're coming?
We are advised that they might well be here together with a whole range of other material, the consumables, the supporting material, the needles. We're advised that their arrival is imminent. I can only tell you what I'm advised, and our friends from the Commonwealth advise that the arrival of the product is imminent, together with all of the other consumables. If I knew the exact minute and exactly where, I would tell you. Rest assured.
Last question, Steve.
On syringes, Brendan Murphy says there might be a shortage of the special type of syringes used to administer the Pfizer dose. Could that hamper the rollout here? Do we want to get it up?
No, we don't believe so. We've been working very closely with our health services and others who will be on the more hub and spoke side of things. Of course, we'd all want the highest quality material, and all of the material we have is of the highest quality, but these specialist ones with, I think it's dead space technology behind it, that's important to get the most out of each vial, and we're hopeful that the Commonwealth ultimately will source those, but that doesn't hold us back in any way, shape or form for the 12,000 delivery that we will start to get out into the Victorian people's arms from Monday.
And just a question on fines. The Premier said a few days ago that they would get information on how many fines for giving out 5-day lockdown. Big poll aren't releasing those numbers. Do you have any idea?
No, I don't. I know I'm the acting Minister for Police, and perhaps I should, but I might have to take that question on notice.
Are you close to a resolution on certain emergency bills? Or do you think numbers?
Well, I'm not in the business of predicting how the Victorian Parliament will process any bill, but Victorians know that if we want to have a system of things like protecting how we guard our international borders from hotel quarantining and the return of the coronavirus globally, that if we want to have a system that allows us to protect our communities during this pandemic, we need the legislative and legal basis to that. If this bill is not passed, then the entire public health framework ceases. And I would suggest that every other state's borders would snap shut the day that happens. So if Victorians want to stay open and want to stay safe, this important piece of legislation needs to pass. Victoria is the only state that has this accountable system in place. No other state requires to come back to their parliament to extend state of emergencies. I think that's a good thing. I think that's a system of accountability and reporting to the parliament that allows that system to happen. It should not be used to put at risk the safety of the Victorian community. So if the parliament wants the Victorian community to continue to be safe and for the vaccine rollout to happen, and to turn this all around, this important piece of legislation needs to pass.
Last questions, please.
I misunderstood Chanel's question earlier. She asked about
Oh, pardon me. Look, we're in discussions with all sorts of community groups as to what are the prospects for particularly 2A and 2B rollout. That will all depend on what vaccine we are provided and how much. If we are provided some of the upper end figures of what we've been forecasting from the Commonwealth, then we will look at all sorts of innovative models. And I want to thank members of both the medical community, the community health sector and others who are coming forward with really good ideas as to how we can do this in a timely and really effective way. The Western Bulldogs Hub is but one, but they all depend on the vaccinations being provided, which we are confident they will be, but until we know in those next steps, phase 1 and A and B is certain and is well planned for and underway. Conversations are already well advanced for phase 2A and 2B, and when those conversations are landed, I'm sure many, many good ideas will be able to be brought to fruition. Thanks everyone.